Hey y'all, welcome to the very first episode of Health Equity Mondays. Woo. You are joined by Jasmine and Omari, and we are going to talk about why we started this show, a one-on-one of what is health equity and how it is achieved, and then expectations of what you'll get from our show. Hey, welcome to Health Equity Mondays, hosted by Jasmine Leonard
and Omari Richins. Here we'll talk about all things health equity, public health, and culture.
Let's do our part to move health equity forward and all that jazz.
Yes, we're so glad that you're joining us here today. And just to go over some intros, my name is Omari Richins. You might know me as the founder of the Public Health Millennial, where I help public health people find career success, as well as a host of public health careers. I also am a program officer with the KP Reynolds Charitable Trust, where we're working to improve the health and quality of life for financially disadvantaged North Carolinians. And I'll pass it on to Jasmine.
Hi everyone, my name is Jasmine Leonard, and I'm the founder of Health Equity Jazz, a consulting firm that's designed to teach you how to be an authentic space taker in health equity and all that jazz. I am also a doctoral student at Johns Hopkins University. I am completing a DRPH in a DRPH, let me break that down, a doctorate of public health in health equity and social justice. I am a Bloomberg Fellow, so I am also very interested in adolescent health under the Bloomberg Initiative. I have a full-time job. I work as a health equity enterprise manager for one of the largest Blue Cross Blue Shield plans in the Mid-Atlantic.
So you might be asking yourself, why did we start this show and what are we going to cover? So this is going to be a monthly show, just to set expectations right there that this is going to be a monthly show.
You heard all the things that we're doing, right? We're kind of busy.
Right. And we take great pleasure in helping and supporting you health equitists out there, but we also don't want to burn out to take care of ourselves, and that's something that we're also going to preach on the show. But what you'll get from this show is we started the show to make health equity accessible and fun. Why shouldn't we share our public health and health equity rants, DMs, and text messages with the public, right?
Yeah, I mean, I think it's about time, right? So we're going to cover all the things within the scope of our understanding, and that's going to include hot topics, policies, new findings, public health mistakes, and lots more.
Yeah, and after listening to this, which I'm very excited about, is that you'll always have resources to check out, tools to use, a fun fact to share with others, and a better understanding of how your everyday actions impact health equity. All right, Jasmine, so as part of these monthly shows, we're going to be doing check-ins, and just so people know, this is January 29th, so yes, when you're listening to this, it's going to be the day after it's released, January 29th. How are you doing, Jasmine?
I am surviving January. School has started, so I'm back to all the many facets of health equity jazz, but it's good. And you know, the sun is setting a little bit later, so I'm excited for some more sunshine. Whew.
Right.
How are you doing?
Yeah, well, thank you for sharing that first of all, and good luck in this semester of school, and good luck to everyone else out there who just started their semesters. You know, it can be tough, but keeping on, and you will get what you need to get. I'm doing well. You know, I just came from a mentorship call. I joined this group mentorship with someone that I've had on my podcast, and who I find is a great leader in the space of health equity, tech, public health work, and excited for that. That was really rejuvenating to be in a space with like other health equitists such as ourselves, and just people in early career. Looking forward to developing relationships and building more knowledge there, and then like always excited to be doing new things like this show. So I'm excited to be giving people a new take from the public health careers platform, and looking to share some great insights and information with all of you all. But I'm doing well.
That's great. This has definitely been a long time coming. You know, we were supposed to be out a few months ago, but it's okay.
So it goes. Don't put too much pressure on yourself, you know. And since we were supposed to be out a couple months ago, just giving you all a recap of 2022, since this is the first month of 2023, January 2023, we wanted to share one big win, one big loss, and then we go forward from there.
All right, y'all. So unfortunately, I have to share the loss of 2022. Very timely given all the things that have been going on this weekend, but we have to acknowledge that in 2022, police killed the highest number of people on record. that's not a small situation. As we talk about a lot of public health emergencies, gun violence, police brutality, all of these things are impacting public health. And, you know, of course, there's going to be a piece of health inequity within that, right? Let's pull up some data about this, right? Because this is where you're going to get all your links and resources to talk to people about what we discuss. So the Washington Post has been tracking police shootings, and I'll caveat shootings, okay? We very well know that that is not the only way that people die in police-involved interactions, but...
And just to be clear, we're talking about in the U.S., correct?
Yes, we are just talking about the United States, where we have the esteemed privilege of having a serious gun violence issue.
Right.
A public health emergency.
Indeed.
Yes. All right. So last year in 2022, police killed over 1,000 people. Okay. Over 1,000. And so the Washington Post has been compiling all this data since 2015 because the FBI does not do a great job of actually recording this information. I believe if we looked at their information, it would be around 300 people that were killed. So clearly something is not going right with their data, but that's fine. The Washington Post has been looking at this, and as you can see in this graph, 2022 right here, 1,096 people were killed by police. Okay, so we're already in 2023, a month in, and 79 people. Okay, but let's talk about health inequity, or inequities within how these killings are happening. When we look at the rate in which people are killed by the police, Black Americans are killed at almost twice the rate of white Americans, despite only being 14% of the population. So a lot of times in public health, health equity, you'll hear things referred to as like disproportionate. That basically means that if we were to be in an ideal world, and I'll caveat, ideal would mean that like no one's actually being killed by police. But if there happen to be situations in which people were in an interaction with the police and died, it should follow the proportions of which people are in the United States. So we know that the Black population is about 14%. So in a proportionate reality, they should be about 14% of the deaths. But that's not what we have here. And I think we all kind of can, we can think of all the reasons why, right?
And let's just be explicit about wording killings and not like just deaths, but like people being killed. Right?
Yes. This is not, I had a cardiac arrest because the police stopped me. This is the police used a gun and killed me. Right. Okay? So, as I said, this is solely shootings. Guns are not the only way that Americans are being killed by the police. I don't want to bring it up, but we will link. Wikipedia has been compiling a list as well, but we all know Wikipedia is an open source kind of situation. So use the data as you will, but it is going to show you some of the killings that happen due to beatings, due to knees on necks, due to tasers, and all of those things. All right, so that's a lot of sad news. Omari, what's the win of 2022?
Yeah, absolutely. And before I show that, I just wanted to say, like, rest in power to Tyree Nichols, I believe it was. I have not watched the video. I don't plan to watch the video, but just rest in power, and hopefully we can create systemic changes so that these kind of things don't happen. And that's like one of the important things that we hope to give out to the show is like sharing these things in ways that make it informative as well as actionable in how you can like better things for yourself. And then the win for 2022, and it's a simple one, but very important, and I think very important in health equity as well as in public health. And it's highlighted in this article by Vox. Okay, so as you can see here in this Vox article titled One Public Health Lesson from 2022 Worth Remembering, and they go through a lot of issues talking about the LGBTQ plus community. They talk about community-led COVID-19 vaccinations, and they also talk about community-led public health works because it's delivered by workers people trust. And what this all underpins, and I think it's said best in these couple paragraphs here, which I will read, but before I read it, is just the importance of having community-based health improvement plans and actions, and really engaging the community from a place of trust and understanding, and knowing that they are the ones closest to the issues, as well as the ones with the solutions to the issues and the problems that they face in their daily lives. So to quote the article, it says, grassroots approaches created by and for people within marginalized groups, including peer support networks and community health worker programs, are often particularly effective at changing opinions and actions, but they are less common in the US than in the rest of the world. If we pay closer attention to the equity gains these strategies can make, that could change. There's some good news on this front. More support for these programs is on the way, with the Biden administration launching $226 million in pandemic funding. Granted, that's not as much money as I'd like. I don't ever say curse anyone's blessing, so give thanks for that, and hopefully there are more substantial and sustainable funding sources to community health workers, to community-based organizations, and just people that are boots on the ground doing the work. And as well as I hope there are feedback mechanisms that give those people a way to act on advocacy and policy platforms to really shift those systems from the grassroots all the way up to the top. And that is our win for 2022.
I think that's a good win. Can we get some claps for that?
Yeah, if you give me 1 second, we can get some claps for that. For that, definitely. Yeah, so I'm glad that we can highlight some wins and some things that could do with some improvement from the last year, and hopefully 2023 is a better year for health equity and for health equitists out here. And as we're talking about health equity, we just wanted to make sure that we're defining health equity and then allowing you all to better understand it. So we'll go to the Robert Wood Johnson Foundation's website for the definition of health equity. Okay, so on the Robert Wood Johnson Foundation website, there is some research that was done, I guess, in 2017, and they came up with a definition for what is health equity. We can scroll down, and we can see that they define health equity right here, and I'll zoom in. And yes, if anyone is listening to this podcast, it is available on YouTube as well, where you can see us diving into the documents in live time, or I guess whenever you're watching, you can see the screenshots. You know what I mean? Okay, so the definition here is that health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and the lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. So Jasmine, I think this is a great definition of health equity, but is there anything else that you think is kind of missing, or there's something that could be added to this definition?
Yeah, so I think it's a good starting point. It's the foundation of what we should be talking about in health equity, but I think we're missing some keywords, words like racism, structural inequality, white supremacy. The words that really get at to why there's differences and obstacles in poverty, discrimination, and their consequences, right? It's giving, we're just not going to talk about the fact that a lot of this is based on slavery, right. The, complete annihilation of many of the indigenous populations that lived here, colonialism, the migrant workers, we're just not going to address what that all stems from. And I think that in the place that we're in now, where there's so many people trying to take away our knowledge and trying to, ban books and ban certain words from schools and things like that, if we can be more explicit with what has caused these issues, I think that gives us a better definition. So Y'all know I love Robert Wood Johnson Foundation, but I think we could probably update this for 2023, right?
Yeah, I wouldn't disagree with that, and also love Robert Wood Johnson Foundation to put it out there in the public as well. But yeah, and I think like the importance that you're highlighting there is something that we'll dig a little bit deeper when we go and talk a little bit about health inequities versus health disparities. But I'll save that for a little bit later in the episode. Before we get to that, I wanted to just touch on the social determinants of health, and I feel like this is something that we could talk on for an entire episode, and maybe that is something that we will do in the future, talking about health equity and the social determinants of health and how that plays out. But simply speaking, it is the conditions in which people are born, grow, live, work, and age. These conditions are shaped by the distribution of power, money, and resources at the local to global levels. And they're the main drivers of health. Like many of us think of the main drivers of health being like healthcare or access to healthcare. But I think it's like that is only 25%, accounts to 25% of health.
20%.
Right, and then all these other social factors are the things that enable us to be healthy and productive. And I just wanted to pull up two graphics here to share with you all, just to like make this cool. Like the CDC did something cool, and they worked with the national
CDC.
Center.
Do we need to break that down for people?
Sure. Do you want to break it down?
The Centers for Disease Control and Prevention.
Right.
I don't know why they leave the P off, right? But okay, it's fine.
Yeah, it's a better acronym that way, But yeah, they're one of the head public health oversight organizations in the U.S. So looking at this graphic from the National Center for Chronic Disease Prevention and Health Promotion, is going to show 6 pillars. So as you can see here, what is the CDC doing to address the social determinants of health? You can see this little cool graphic that talks about policy, law, data, surveillance, evaluation, and evidence building, partnerships and collaboration, community engagement, infrastructure and capacity building. And then in the middle of that, there's equity. And then in the middle of that, there's the social conditions, or the social, as well as the structural conditions and the social determinants of health. So I think this is like a great way to really think about the social determinants of health and the framework for how we can like improve it and work towards it. And then just to go over the social determinants of health themselves, I did have a graphic from the Kaiser Family Foundation, which I will share now. So as you can see in the diagram from the Kaiser Family Foundation, and all the links that we use and things that go onto the screen are going to be linked in the description, as well as the show notes for you all to check out and dive deeper and like get a better understanding of that. But you can see that the social determinants of health, they broke it into 6 categories, and you'd see it in different places, like 5 to 8 categories is what you see, but they typically encompass a lot of the same things, and they might just go into different categories. The categories that the Kaiser Family Foundation uses is economic stability, so things like employment and income, then neighborhood and physical environment, so things like housing and transportation, then education, which is literacy and language and other things around that, as well as food, which is an example of hunger or access to healthy options. And then there's community and social context, which is talking about support systems and community engagement, as well as healthcare systems, and that's talking about health coverage and provider availability, as well as other things. So as we can see, the social determinants of health span all the factors that impact our lives and how we live, work, play, age, and everything in between. And it's really important in the conversation around health equity to understand that there are social drivers that impact our health, and understand the history and the structural setup of those social drivers that have led to the current health outcomes, and what needs to be done to move forward to get better and more equitable health outcomes. So I just want to share that with you all.
Yeah, so now that we understand the social determinants of health, and I think, maybe in another episode we can talk about the political and structural determinants of health, because those are also coming up in conversation as we start to really dive into it. And yes, the political determinants of health. Omari showing his book. Now let's dive into health disparities versus health inequities. All right. I know that a lot of times people conflate these words and they're like, oh no, this is the same thing, but they're not. Okay, so let's break this down. A health disparity refers to a difference in health outcomes that exists between different groups of people. This can be based on social determinants of health factors such as socioeconomic status, education, gender, sexuality, so on and so forth. They can be seen in a variety of outcomes such as life expectancy, infant mortality, rates of chronic disease, COVID-19 status, all the things, right? And key here, it's a difference. It's just the sheer fact that there is a difference in, say, the rate of infant mortality for Black women versus the rate of infant mortality for white women. That's it. Difference, disparity, same. You could even start saying health differences if it makes it easier for you, but that's it. It's just noting that there is a difference. All right. So when we start to talk about health inequity, we have to layer in, why is there a difference, right? Like, why is there a difference between the rate of infant mortality between Black and white women? Why is there a difference in the rate of COVID-19 deaths versus COVID-19 deaths for another population, right? Like, that's when we start getting a little deeper into the information. All right, so health inequities, those are going to be the differences in health outcomes that are avoidable, unfair, and unjust. They occur as a result of systemic inequities and discrimination, i.e. racism, white supremacy, colonialism, all the things, right? Health inequities are not just the result of individual choices and personal characteristics, but of social, economic, political, environmental, all of the systems that exist around us that essentially dictate how we end up in situations that we do.
That is very important, because too many times we do go to individual choice. So a lot of people have a train of thought of focusing on individual choice, but not understanding the social context for what brought people there. And I just wanted to note that, like, as Jasmine said, like, while disparities can be seen as differences, or so you can think of it as health differences, as Jasmine said, in health outcomes, inequities refer to the reasons behind the differences, which are often rooted in systemic inequalities as well as the social determinants of health. And examples of inequitable actions would be things like police practices that disproportionately affect marginalized communities, such as cutting funding from community health centers, reducing Medicaid coverage or not expanding it, or failing to address discrimination in healthcare. As well as there's a lack of investment in public health infrastructure and services, lack of affordable housing, lack of access to education, lack of safe, walkable neighborhoods, and a lack of economic opportunities for marginalized communities can also contribute to health inequities. So these are just a few examples, and I guarantee you during these episodes we're going to dig deeper into a lot of this content. And if you do have any questions or topics you want us to do, just feel free to let us know as well.
Yeah, so all right, we have to end on like good notes, right? So we've talked about all the differences, the inequities, and now let's talk about how we actually achieve health equity, because that's the goal, right? That's why, well, I don't know about you, Omari, but that's why I'm in public health. I would love to not have a job someday.
Right.
So
I completely agree with that. Love that. And that's the mindset we need.
yeah, so the day that I don't have a job will be when we achieve health equity. So that's going to be when everybody has the opportunity to attain their full health potential. No one's disadvantaged. And essentially, like, we're just out here living our best lives. Okay. So, and that means Omari and me, you know, the other people down the street, everybody. It doesn't matter about your skin color, your gender, your sexual orientation, how much money you make, how much money's in the bank, your wealth, all of that stuff, where you're living. Like, you're just out there living your best life. So in order to achieve that, we got to work on some things, right? We have to, one, be a little bit more explicit in our definitions to understand and address the underlying social, economic, and political factors that create and sustain health disparities, right? Because we know that they continue to persist over and over time. So that's going to include addressing poverty, education, housing, access to healthcare, as well as ensuring that healthcare services are culturally and linguistically appropriate and that they're provided in a way that is welcoming and inclusive of all communities and individuals. There are a number of frameworks that we can explore in the future, but the big takeaway here is that the concept of health equity is not new. It has become a buzzword du jour due to all the things in 2020, but it has been around for decades, and we know that there are many scholars, doctors, nurses, and public health professionals who have been working to advance health equity for decades. And we are some of them that are just trying to follow in their footsteps. We have a long way to go to achieve health equity, but we can get there. We can make small steps, baby steps towards health equity day after day. And listening to this podcast is kind of one of them, because, you're starting to educate yourself and learning what could you do, right? And what are some facts to share with people, and sharing our work, sharing our information, and all the things around health equity and all that jazz.
Yeah, absolutely agree with that, and look forward to sharing more around that. We definitely need to check our notes. We should have put public health professionals before all those other professionals that we named out there just now.
Sorry.
Sure. Yeah, but just like making the world a place where your zip code doesn't determine your health outcomes, and like trying to deal with more original problems. And at the same point in time, we understand that these big issues that we need to fix, but we also have to understand that these issues have been systemically placed to be what they are, and it's been this way for decades, if not centuries. So, just not being a martyr to the things you're doing. Yes, the work is important, but you as a person are also very much important. And yeah, be sure to subscribe, because this is going to be one of the places that you can get actionable advice for equitable. I don't know. You can get actionable advice for equitable information and ways that you can apply that to your daily life. So just some expectations of the show. As we shared earlier, it's going to be a monthly show. We're going to be sharing different topics around health equity. If you do have any questions or topics that you do want to share, just send them to us. You can DM us, or you can share it on our links, which are going to be thephmillennial.com/HEM for Health Equity Mondays, or healthequityjazz.com/HEM. And those links will be in the description below as well if you'd like to ask us a question or have a topic that you'd want us to talk more about.
We will always end on good notes, fun notes, right? Like, a lot of things are super serious, and I can't end the day like being sad about life. So we're going to play Equity in Action.
Hey.
So you're probably like, what is Equity in Action? This sounds really cool, right? So basically, the scholars that we are, Omari and I just want to see if we can stump each other. So we're going to come with true or false questions, multiple choice, and all the random facts that we potentially know in health equity and public health. And we're going to see if we get the answers right or not.
Yeah. I guess we can keep a tally as well.
Yes, I think at the end of the year, we're going to have to figure out like what happens if you get more wrong or something. Like, I think there should be something. Yeah,
and you all can let us know as well. Like, go to those links in the description and let us know what should be the prize or the consequence of this quiz that we're doing, the Equity in Action quiz, I should say.
Yes. All right. So Omari has chosen to go first since he made me do all the losses and things for the year. So, true or false? Okay. Are you ready?
I'm ready.
Okay. True or false? At any given time, there are only 12 black donors in the national sperm banks.
12.
12. 1, 2.
Only 12 black donors, and that's wild if that be real. I have to say that is false, because that's just wild of a concept of 12 people. I've had a bigger MPH class than that,
Well, first answer wrong. So
what?
Yes.
Damn. That's wild though.
Let's pull it up, because again, we are going to share this information so that you can share with your friends and talk to people about it. October 20th, 2022, Amber Ferguson wrote a Washington Post article about the shortage of black sperm donors. So again, we will link this for you, but there's a nice graph that shows America's black sperm donor shortage. And if you look there are only 12 Black donors out of, let's say, how many people is this? My math is bad.
It's like 4 and 3 and let's say 1. So it's
like 700 people and
like
only
800,
12?
900, yeah.
Okay, so yeah, so it's bad. It's less than 2%. So for math people out here, less than 2%. And let's go back to what I shared before, right? How many Black people are in America? 14%.
All right.
So,
all right. So that's really sad. And just to be clear, the data here does say that it was donors by race at the 4 leading U.S. sperm banks. Just to be clear, but like I think percentage wise, that is amazing. So I don't know if that means I got this correct or wrong, because percentage wise, that wasn't the question. Like, because I'd imagine if we go past the 4 leading U.S. sperm banks, it'd be more than 12.
So actually, these, and maybe I should have worded it differently, but these 4 are like actual sperm banks that go through all the like rigmarole of evaluation. Yes, there are other sperm banks, but they're not going to have the same protocols in place. And there are also other ways that people can get sperm, clearly. Maybe I worded it a little misleading,
right.
but
I'll take the loss this week. But don't worry, next, or I guess this month, next month, I'm gonna come up with something hard that you're not gonna get. That's for sure.
I don't know. I mean, I've always been savvy with knowing just random facts. So
all right. Well, the people out here will hear and see if that is true or not, or if you just cap it. Just to be honest. Anyway, but thank you all so much for joining us on our first episode of Health Equity Mondays. We're so glad that you were able to join us. Be sure to subscribe, share this with a friend. Greatly appreciate that. Happy Black History Month. We will see you again at the end of the month. You're right.
End of the month. It's the end of it's the end of February. It's gonna be right before my birthday, so we can have like a little happy birthday song and all that stuff.
Okay, we'll figure that out. And just because it's our first episode, we didn't drop the promos in the middle of the episode, but if you're listening to this far, thank you so much. Where can people support Health Equity Jazz?
Health Equity Jazz is at Health Equity Jazz on Instagram, at Health Equity Pro, PRO, on Twitter, and also LinkedIn. You can now search Health Equity Jazz on LinkedIn, and I should pop up right there for you. So you can find me in all those ways. And I also have a newsletter that is available, healthequityjazz.beehiiv.com. There you can follow my doctoral journey. You can subscribe and pay a little bit of money to hear from me more frequently and actually get some of the like behind the scenes. I actually just wrote about like home and how hard that has been to find what feels like home for me. So if you want the Jasmine behind Health Equity Jazz, that's what that's for. And merch. So Black History Month is coming up. I have some new merch on Health Equity Jazz. So my website, healthequityjazz.com/merch. You can find some cool Black History Month merch on there.
Awesome. Well, yeah, be sure to connect there. If you're listening to this, be sure to subscribe to this podcast, Public Health Careers, where Health Equity Mondays is going to live. Be sure to follow me on Instagram at the PH Millennial, on LinkedIn. Connect with me and follow the Public Health Millennial page. And if you'd like to support this show, outside of those things, go to Coffee. I think it's pronounced Coffee or Ko-fi with the ko-fi.com, and the link is below, where you can either subscribe to support the platform on a monthly basis, or you can just buy me a one-off coffee, which I would greatly appreciate. So the link is below, and thank you all so much for tuning in.
Thank you. We're so excited.
Yes, we are. Peace, everyone.